So I'd like to call the meeting to order and have the approval of minutes that were emailed to us.
Motion to approve the minutes?
I have a first, do I have a second?
I second.
Second, call for the question, all in favor?
Aye.
Motion passes. We go on to public comments, and we do have two visitors today that will be giving us some comments.
We have to,
Hi,
can you state, if you can be here, because you need to come out in the film, and can you state your name, where you're from?
Hi, my name is Yvonne Pacheco. I'm Jasmine Vidal. We're from Greenwood Community Health Center, and we're from the opioid program. Basically what we do, we wanted to introduce ourselves. Manny invited us, it was so kind of him. We met him today. What we do community education. We try to go out to the community, talk to people. We've gone to UISD, the nurses there. We just went right now to Gateway Academy. We talked to the parents, to the students, and provide awareness of what's going on with the opioid epidemic. A lot of the times when we speak to the parents or even the students, we do have to break it down to them and talk about what opioids are, because most people in our community, you say opioids, they have no idea what you're talking about. So we kind of explain that to them, and that's part of our community education. In our clinic, aside from our waiting area presentations that we do in the different waiting areas that we have, we also we're working on a curriculum right now, currently on opioids, where so far, we're trying to work, there's 5 different modules. We talk about opioids, how they work on the brain and body, addiction, misuse, kind of break it down. And then right now we started with pain management. We started doing our sessions there. So we've been able, this is the second group that we got and barely started. Patients from the clinic have shown interest in it, and they've responded really, really well. I mean, they do attend the sessions, and at the end, I mean, they really learn a lot, and they seem to enjoy it. Any comments?
Ms. Pacheco, how does the work out when you reach out to the community outreach education program? How do you define your target population?
Right now, to be honest, Torres, I think?
Yes.
Yeah. We're kind of targeting everybody. It doesn't matter, teenagers, adults. We kind of go out there, we introduce ourselves, and we talk about opioids. We start a conversation. And in terms that they're going to understand, because like I said, you tell them we're here from the opioid program, they really have no idea what we're talking about. We tell them we're talking about opioid painkillers, and then we describe like codeine, Vicodin, have you been prescribed this? And we talk about the effects that they have, and encourage them to have better patient-doctor communication, and find out whenever they get prescribed something, try to look it up, try to know what you're being prescribed and what you're taking, because that's really important, and that's going to make a difference.
Well, the commission itself is working with the city, of course, and all of our stakeholders to try to get something started here in the community, detox, et cetera, and we also talked about education, educating in schools, the university, et cetera, around in the community, and we would love to be able to recommend you to as part of our program, right? All of us together, it's everybody in the same group, there's no city or whatever. Yes,
Yes, that's
Perfect.
wonderful.
Thank you.
Thank you.
Do you have any packets or?
We brought flyers,
Okay.
and like I said, our curriculum, I mean, we're working on it, but we're really proud of it. I mean, it's still a work in progress, but we try to break it down to the 5 components. Our last session actually, or second to last, we talk about alternative pain management practices, which is very important, to make sure they don't go straight to an opioid whenever they get prescription medication and they feel pain. So our 5th session, we try to put videos and encourage them to do other things, and we show them this is what you could do. These are the
Is
different.
this your curriculum, or is it a HRSA evidence-based?
Not yet. We're
curriculum?
kind of working on it, and I think they're trying. It's a work in progress. We're kind of.
But HRSA is gonna have to bless it.
Yes, of course.
And y'all are gathering data as far as an increase in knowledge, and how are
Yes,
y'all
we're
measuring
trying
that
to,
it's
like,
working?
It's barely like our 2nd class, so we are working on it.
Okay.
We're still working on it. Like I said, it's a work in progress. It's still really early.
You want to contact DAH James Reese, I believe his name is. He has a lot of stats. He gives a presentation on opioid addiction and fentanyl. And he has all kinds of statistics that might be beneficial to us.
Okay, yes, thank you so much. We have been in contact with one of the DA agents, but I kind of forgot her
What
name,
name?
I'm sorry.
If I may, my name's Colleen Rodriguez. I'm part of the commission and I am alongside with another commissioner having to promote and market on our Facebook page. So if I can, I will be in touch with you. That way I can put some of that information onto our Facebook page and start maybe putting some awareness or updates, any videos that you might have. The idea is just to continue to share that there's resources that are available for the public for help.
Yes, that would be great, yes. And like I said, we're kind of focusing more right now on our community ed, and then our curriculum is still kind of, we're still doing the research, getting everything together. But our supervisors wanted us to kind of get a little group, and like a very small group, to see how they would,
Pilot.
yeah, kind of like pilot, and it's a work in progress.
Well,
So
that's
we can change.
perfect, because that's where we're heading with trying to get, community awareness and community education in the schools and different Girl Scouts, whatever, you know, just go out to the public and educate.
Yeah.
So we thank you for coming forward. Thank you so much. All right, then we go on with a presentation and possible action, and the first would be with Judge Martinez, Hugo Martinez, who's here already, and with Pillar, who of course is always here. Thank you so much.
Thank you. If I may begin, several months ago, Judge Martinez's office reached out to us about this idea he had to extend services to inmates at the county jail. The belief and concern was that there were individuals that were being held in custody, but there were no kind of rehabilitation activities taking place. And I know that that was a concern that had been raised by members of this committee, that through personal experiences or just general knowledge, they were concerned about what was happening to individuals with chemical addictions that were in custody. Was there any type of aid that was being provided to them, structured activities to try to get them to get over their addiction? And so when we met with him, I voiced that to him, and he expanded this idea he had of us trying maybe a pilot project to utilize one of our LPCs at Pillar to go in there and start working with some of the inmates that were under his jurisdiction. And so we started that project. Again, it's a pilot project, and who better than Honorable Judge Martinez to be here today to talk about his brainchild. Judge.
Well, thank you all very much for allowing us to be present here and to address you all. You know, last year I had a lady in my court, and she had about 8 cases pending, and she got a package deal from the district attorney, and she got rid of all 8 cases. This year she had another 10 cases pending, all right? And so this time around I said, you know what, this lady obviously has a drug addiction problem. Come to find out it's a heroin problem. And so I told my staff, I said, look, I want to start a program whereby we can give services to all of the people that are in the misdemeanor level. Because there are some individuals that never rise to the level of a felony offender, all right? Because they know that if they do that, they could be sent to prison. So they always stay here, you know, but at the felony level, there's a lot of programs that are available to those individuals, but at the misdemeanor level, there isn't. And I know that Paul heads up the drug court program from the district attorney's office, but somebody like Francisca probably wouldn't have qualified because she just had too many, you know, and it had gotten to the point where, you know, if an individual has a case or 2 pending, they go to the drug court program, their cases are often dismissed. But she had 18 cases within a 12-month period. And so I don't think she would have gotten all 18 dismissed. So what I told my staff, and then I told Manny, was, I said, I'm going to get these individuals, and I'm going to get rid of their cases, but more than likely I will stack the sentences so that if an individual comes to me, and in this case it's a lady by the name of Francisca, I told Francisca, on this first case that you're pleading guilty to, I'm going to give you a sentence of 6 months. And on this other one, I'm also going to give you a sentence of 6 months, but I'm going to stack them. So you're going to be in jail for a full year. However, if you go through the drug court program that's being administered inside the jail, you can cut that time in half. And so you can actually get rid of everything within a 6-month period if you successfully go through the drug court program. Now, I know that sometimes when people are outside and they go through the drug court program, they will cheat. And sometimes they get away with it, because the drug leaves their system within a certain period of time, and there are things that they can take to flush out their system. But in this program, they're inside the jail, and so hopefully they'll be sober for 5 or 6 months, and whatever counseling that we can provide to them will firmly take root. Now, in Francisca's case, her husband, Rocky, is also a heroin addict, and he's also in jail. I have him in jail on some cases. He has about 6 pending with me. And I spoke to Manny and Nadi, and we're trying to get him into the program as well, because if we don't address his problem, then we're going to give Francisca 5 or 6 months worth of counseling, and then she's going to go right back into the same old situation and more than likely start using again. And so we're going to try and help out these individuals once and for all. I'm an old public defender. In fact, I managed the office for about 6.5 years, and I can tell you that there are individuals that were clients of the office when I started as a 32-year-old, and I'm 59 years old now, and they're still clients of the public defender's office. There's one individual, and Mr. Torres may know him. His first name is Mauricio. He's been arrested like 56 times. And Francisca, the lady I'm talking about, she got arrested 19 times within like a 13-month period. It's one of those things where you look at the situation and you say, shame on these people for falling prey to the addiction, but shame on us if we don't do something to help them. And so I told Manny, I said, we need to do something about these people. We're going to offer them the services. It's a win-win situation from law enforcement standpoint. They got sentenced. They're going to do some time. From the individual's standpoint, they're going to get the treatment they deserved and needed for such a long time. And hopefully it'll take root. And from society's standpoint, these are individuals that on a daily basis go and steal from Kohl's, Target, Walmart, H-E-B, you name it. And so that's all they live for. That's all they live for. Now, I know that some of you have seen a lady being pushed in a wheelchair and she has no legs. All right. My bailiff, Pat, has been a deputy sheriff for about 25 years. And Pat tells me, Judge, I remember when she had 2 good legs, but she's a heroin addict, and they had to amputate those 2 legs. Again, we never gave them the help that they needed. And we have the opportunity to be able to do that. Now, I know that there's criteria when you enter the 406 drug court program. You can't have been caught with a delivery of a controlled substance because you may be seen as a dealer. You can't have had a violent crime in your history. But in my drug court program, anybody's welcome because you're going to be doing time. But we have one individual in there, and I think we just got the second one. And it was interesting because that lady was looking at what Francisca was doing, and she wanted to enter the program. And now we have about another 2 more candidates that hopefully will enter the program.
Does that include Vivitrol too?
It doesn't include Vivitrol, because these individuals are going in there and they're stopping cold turkey, you know, and so, but one of the things that we need to do is we need to be able to go ahead and make sure that that once they're released, that they're going to be helped later on. We've got a visit from SCAN this afternoon, and apparently they have a grant for aftercare
Sure, it's a reentry program, so it's a SAMHSA grant, so then I think it will link really well with your program, where they're about to be released, and we can come in and then develop a plan so that they reenter the community and get them into, you know, continuing care,
Right.
help them find a job and other resources. We also can provide medication-assisted therapy. There are a bunch of other services, but I think it'll be a great way of linking services. Right, they can begin the in-jail treatment. Then, when they're about to be released, I was going to say discharge. When they're about to be released, then we can come in, look at, you know, kind of get an idea of what the treatment consisted about, and then continue once they're back in the community.
Right.
We have a really strong case management, Judge, so then we're not going to let them drop.
Excellent, excellent. Now, the other thing that we were exploring, and Manny and my staff and part of his staff, we had a meeting about a month ago, 2 months ago.
Correct.
We met with the people from Workforce Solutions.
Solutions.
Apparently SCAN is also working with that. And one of the things that we were talking about this afternoon with Humberto and Mr.
Manrique.
is that hopefully we can maybe add a component to that and have services whereby, you know, these individuals are given some sort of a vocational training, have them develop a skill, whether it's as a plumber's helper, an electrician's helper, carpentry, you know, anything that would help them. Because let's face it, a lot of these individuals did not graduate high school. You know, they may have started their addiction because they weren't suited for the educational atmosphere, and so they don't have any skills, and so we need to have them develop a skill that they can then be proud of, and that would make them marketable to individuals or organizations out there. So I think that would ensure their success in their recovery program.
Yeah, that really strengthens the recovery when they get skills and then they feel, you know, a sense of self-competent. But another thing is that because we have residential treatment programs, at some point if they relapse, and then we can link them back into residential treatment. So I think it will be a great partnership if that's okay with you guys.
When will your aftercare start? My daughter will be getting out in 45 days and I'm terrified.
Just let us know.
So you're ready?
Yeah, I mean, yeah, we can see it right away. I mean,
Oh, okay.
where is she right now?
She's near Dallas.
Is she in a treatment facility?
Yes.
Yeah. As soon as she gets out, you'll bring her to the office.
She's in a lockdown facility.
Okay.
I would like to now ask that we can allow Ms. Ari Canales to speak. She's the OPC that's been working on this project, and I would like to, if it's okay, Ari, for you to share with us some of your experience.
Sure. I mean, I've been working with Ms. Francisca for a while now. It's been about 5 months. And we've been focusing more on relapse prevention. What I told Judge Martinez was I want to leave her with a set of skills that she can basically use when she comes out, and then of course link her to other places where she can continue with the care. That's what we're being focusing on, basically.
And Nadia, if I may use this opportunity to ask you what you think about her progress. Is she ready to be released?
I would say yes, as long as she continues with her progress. I think that she's done a marvelous job as far as progressing. Like I mentioned to Judge Martinez, one of the first things that I noticed as far as progress with her was that she will always complete her homework and do a copy for myself, so I can keep manually a copy for myself for her file. And she would gather all the inmates that are on her same cell, and they all will complete the homework with her too. So to me, that's a lot of progress.
Okay, because she is scheduled to appear in court tomorrow,
I know.
and I know that she's been itching to get released, but you know, she still owes me about 6 more months,
Right.
but or 5 more months, but if she's ready and you think she's ready to be released, then it's something that we can talk to the sheriff about. But I guess the important thing is not to release her until perhaps maybe Scan goes and
Sure.
pays a visit and makes sure that,
we can
Yes.
kind of talk to each other
Yeah.
and then definitely.
I think one of the things that's important to underscore here is, and I learned this obviously from our conversation with Ms. Canales, that there are other inmates there. And again, this is not something that should shock any of us, that we're very excited to learn that something was being done with one of their peers, and they all wanted to be a part of it as well, asking if there was an opportunity for them. And it really speaks to what has been shared during these meetings in the past, certainly by you, Ms. Arguindegui, that there are people in custody that want an opportunity for rehabilitation services. And I guess all of us have at one point or another maybe made attempts but never fully brought something to fruition. And maybe this is step one of us getting something underway.
What is your capacity, man, for that program? What is your capacity for the
Well,
program?
right now it's just a pilot. We're starting with
The one.
Francisca, but we're trying to build
So
on
if
that.
there's need for more, because we can send also our staff there.
And again, we can certainly have those
So then let's
discussions.
identify those. The only, for that program has to be at least 90 days in jail. So that would meet that, minimum requirement.
and now, if they, what happens a lot of the times is that an individual will have for example, a misdemeanor probation as well as a felony probation. And because we addressed the probation office as well, and what they're willing to do is, if somebody is perhaps maybe on the verge of getting revoked, they can refer them to our program, and then we can go ahead and I can revoke his probation, sentence him to the full time, and then, but also tell them you're subject to having to cutting that sentence in half if you go through the drug court. The other day, I think it was yesterday, there was an individual that was on probation, and he tested positive 15 times for marijuana. A couple of those times it was marijuana and cocaine. Now, why the probation officer waited this long to file a motion to revoke, I don't know. But we're failing these individuals. As an old public defender, I can tell you that a lot of my clients in the past died on me because they never got the help that they needed. And this program is designed to have the individual do their penance while in jail, but at the same time benefit from that, because they will be away from all of the bad influences that have drawn them to their addiction. And I think people like Adi and people that are with SCAN can certainly help these people out. And I think the Lord told Ezekiel one time, look, if your brother is sinning and you tell him something to correct his ways, then you'll be saved. But if you don't tell him something, then it's on you. And so it's on us if we don't help.
Judge, and if you're privy to providing the information, Francisca, she's been arrested or she's a reoffender for what, charges? What has she?
Thefts, Walmart, Kohl's, you name it.
Through this,
Feel the addiction.
through this program, does the individual have, or the attorney, or who recommends that they are in fact an addict? How do you decipher that?
You can see it from their history. If all they keep doing are thefts, burglars of vehicles, they have an addiction problem. And I would venture to say that about 90% of all the cases are either drug or alcohol related. You have very, very few individuals that really are mean or disrespectful, but the majority of these people have some sort of addiction, and they're just trying to feed that. And so I think if we address these people, then hopefully we can cut down the crime in the way.
Now, I'm pretty sure the treatment is different based on the person and the addiction.
Right, I was
What is
gonna-
the average?
Well, I was going to say again, considering that it's in its infancy stage and we're just working with this one person so far, the battery of assessments were done by Ms. Canales to make a determination for diagnosis that obviously was within that realm of a substance use disorder along with other issues. But in the future as we expand on this, people are gonna have to go through a battery of assessment before we just make that judgment call on what is the best course of action to work with.
I mean, 'cause I think it's a wonderful idea. I think it's fantastic to place it, but I think, you know, in the pilot to make sure that there is no cracks, you know, there's
Right.
no faults, because I think having to have that aftercare is a most definite, you know, where there's the prevention, there's the during, there's the after, there's then the follow-up.
Yes.
Because I think in you know, a couple of months ago, we were discussing juveniles, and it's the problem where we don't follow up with the juveniles. They're at the detention
Right.
center, but these are the same people that
Yeah.
you'll see in your court. So
Mhm.
what's happening between then
Correct.
and now, when we should be able to prevent it at that point in time.
Yeah,
So-
and finally, you should mention juveniles, because about 2 weeks ago, Judge Martinez, Leticia Martinez does the detention hearings for us in my chambers. And I finished my court, my docket, and I walked into my chambers, and they were having a detention hearing for Rocco, the son of Francisca and Rocco. So he's already in progress. You know, but you know, it's just a family tradition, I guess, with him, unfortunately, because he doesn't know any better, and so he's already going down the wrong path. But with Rocky, the husband, we were hoping to have had him in the program, but the defense lawyer thought that perhaps he had some sort of mental issues and wanted an evaluation. And so my concern is that Francisca will be released. Rocky will not get the help he needs, and she's going to go right back to living with a heroin addict, who will more than likely, you know, convince her to start going back again.
If I may, Gabriela here is resident, and she oversees specialized female treatment services, and she may be benefit more for a certain specific program. So one of the things that I'm concerned about is that she's released, she's gonna be exposed to a lot of triggers. Once you're in a safe environment, I'm not saying that it's easier, but you can focus more on retreatment. So then I was wondering, maybe you can talk to Ali, and then see when, before she gets out, that we immediately have her linked to the project.
Well, one of the things is, with my daughter being in there, and listening to the issues that are in there for the girls, that, you know, we're trying to restore them instead of just punishing them, you know. They don't get to see the light of day, they're just there. The guys do, but they don't, maybe once a week. Over where she's at, the same thing. So it's like the guys get the computer, the guys get to play basketball, the girls are like, you know, locked in there with they don't see light. So when they don't see light, we all need light, sunshine can help us. So they need to go outside. So I don't know what can be done, but why boys yes and the girls no? I mean,
I think
it's 2018.
I think it's just the number of inmates. You know, you have all of these males, let's say 500 in the jail, and only like 40 of them, you only have like 40 females, so it's difficult to make time for them, maybe, I don't know.
That's not a acceptable answer.
No, and I understand that, but
I mean, because she's my daughter, your daughter were there, I'm sure that would not be an acceptable
Sure.
answer. Because we're treating them worse than an animal, you know.
I agree.
Madam Chair, if I may, Madam Vice Chair, we'll post that to, and here's Chief Torres, that may have shed some light, but we'll post that up to.
Well, we're trying to restore them, they need
You're right.
sunlight.
Yes.
That's just a
So
health.
why the difference? And so we'll put that question up.
Well, it's just that we're stewing them in anger, they're getting angrier and angrier, and they're stewing and they're getting angrier and boiling, and we're not restoring them, they're getting boiling angry in there.
It's a matter of equality, I don't, you know, it should be
It's just
equal.
not an acceptable thing, they're all equal prisoners, they're all equal drug addicts or whatever, but,
In regards to
sorry.
You know, one of the things that we talked about with the representative from SCAN this afternoon was that if you have a felony conviction and you're on probation, they can send you to a facility called what we call a safe beat. And I think the closest one to Laredo is in San Diego. Why? I don't know, but it
Well,
is.
she's in Henderson with, what, is she in safety, or she's the one below the top, whatever the highest one is, she's right below that one. So if she doesn't go to drug court because she doesn't have transportation, she gets thrown back there.
And I apologize, being a drug prosecutor, the volume that I have is pretty immense. I
Well,
feel like I'm
whatever the top
in misdemeanor court.
Oh, whatever the
But
top of the safe P, I guess it's safe P, what's the next one below?
Well, safety is the one that
that's-
mandates incarceration.
Cause that's where she's at.
I think, if memory serves me correctly, but I might be wrong on this, your daughter might be in an intermediate sanction facility, ISF.
Henderson. Okay,
And we tried to put her in safety and she refused.
I know.
And the judge put her in ISF to try and work, try and make her happy. But I guess safety is always an alternative if she continues to test positive when she gets out.
Right.
That's the good thing about it.
Right, but
And we were talking about how, you know, again, the closest facility is San Diego. Some of these poorer families do not have the transportation
Mhm.
to go and visit them. So you have an individual that's in there and shut out from the loved ones for 9 months, 12 months. And then when they get released, like you say, they may be full of anger and so they'll
worse.
reoffend. Here it's local. It's at the Webb County Jail so that the families can go visit them. Hopefully give them encouragement. You know, for a lot of these individuals, it might be the first time that they really see their loved ones sober
yes,
in years.
that's right.
You know, and so we're hoping that collectively we can do some good for the community. You know, it's a work in progress. It is by no means, you know, set in stone. But Manny and his staff and with Ivy have they graciously have helped us a lot. And hopefully with SCAN we can bridge the two programs together and we can be successful.
Do you think I'm sorry,
Go ahead, go ahead.
some sort of program could be initiated to counsel the family members or the loved ones
Yes,
as well?
that's
Because I think that would be important because I wouldn't know what to do
That's
or what to
right.
say. You know, I
Or
would
say
need
the
some
wrong
guidance toward
things.
that. It's like, cause I'm gonna be upset, first of all, that he's in jail or that he's at this point, and that's not the
Helping
approach to
them.
take.
We'll be in parent mode.
Right,
The project
right.
does provide,
For that?
That's
family,
right,
yeah,
that's a
the
good thing.
individual group of family responsibilities.
Yeah.
So
I
yeah,
also,
family
I also
counseling.
wanna mention something, and of course, we always are up for collaboration and we will, but we also have some federal projects under our umbrella as well that can help with some of those things. So we will certainly provide a buffet of options for clients that come out, certainly, and their families as well, for sure.
Yeah, we need to know how to approach them, to help them instead of, because they're already angry at us. So we put them there.
I
Yeah.
did wanna
Two
ask,
questions.
how are you identifying and addressing their mental health while they're in there? I know
Yes,
you're
good
addressing the
question.
substance component, I'm more than sure, she's very well trained, but she's also addressing it, but how are y'all sort of in the aftercare component? Like you have some individuals with severe mental illness that counseling isn't enough. They need medication, a lot of them don't have the insurance. How are y'all gonna address those components?
Well, we're hoping that the SCAN can help us
Sure.
in that regard. I'm not by any means trained in treating these individuals. You know, I can only identify those individuals that need the help. And a lot of these people are very, very forthcoming when they're in front of me. I'll ask them, I said, what's your drug of choice? They'll tell me.
If I
Yeah,
may add,
yeah, they will.
if I may add, once someone has been diagnosed with a mental deficiency, 90% of the time the county jail refuses incarceration, immediate referral as a mental patient, and you know, with a criminal background, and then of course, or region has to take a
yes.
look at it. But going back to the issue about what makes an addict an addict, you know, this past 7 days, we arrested 27 people. 7 days, 27 people for possession of illegal narcotics. 14 people were driving drunk. That makes 41 people that are either using drugs or getting drunk and driving. Now, the total arrest of 7 days by the Laredo Police Department was 139. So there's some people arrested for theft, some people were arrested for assault, in other crimes. Those people that are arrested for assault and theft and all that might also be an addict because they were involved in other type of crimes and they get arrested as a consequence of being a user. Nonetheless, Judge, if there's anything else that the police department they can help out to identify who would be a perfect or a good candidate for a misdemeanor court, drug program court, let me know. We'll run their name and through our process. Because you said it right, we have with the absence of arrests. We don't see what is the disposition of those cases usually because they just roll the door in our system.
That's always gonna be that.
But you need to identify who would be a prime candidate that needs to be arrested not only in possession but also in violence and victimization of our community, part of the economy as part of the team, and just file that information and send it back to you.
We will, Chief, thank you.
And just to extend, because I work there with Border Region, so in case, there's referrals there that that are severe, actually Border Region sees all clients now, not just the 3 primary, which was the schizophrenia, bipolar, or major depression. So they pretty much oversee everything. We have a primary health clinic there as well as the pharmacy. They also have a program that assists with free medication in the cases that they don't have the insurance. And we also have an outpatient treatment program for substance use. So if they're going there to Border Region, we also get offered our outpatient treatment for substance use.
Okay. I was gonna ask also, I know that, it might sound strange, but it's part of their recovery. It's a terrible thing to think about, and I was shocked when I saw my daughter. But one of the things she's asking me for to help her recover is to help her get rid of the chickenpox looking marks all over her body. So maybe we could get a doctor or somebody to help them, because when we see them, it's shocking. I don't know if you've ever seen something like that, but it was shocking to me, to see her whole body full of black tar, heroin marks. So that's something to consider, that we can ask some doctors to help with, to help them recover, so that they won't want to.
That's why we're here, to hear what everybody offers, to see how we can all come together, and if there's gaps in services, we can enlist the help of our medical providers in the community to come to the table and help individuals such as your daughter. That's the whole purpose of why we're here.
Madam Chair, for the benefit of Judge Martinez, what the commission has been tasked to do by the mayor and city council is to look at what needs to be done in this community to address not only the opioid crisis, but substance use, both chemical and alcohol. One of the first things they did, and we're about to really promote it through Facebook, social media, to the city's webpage, to the stakeholders themselves, is they updated the directory of who's doing what. Because it's a continuum. The person with addiction may have a pure addiction, but usually has a behavioral health issue, and also has an underlying medical, both an acute and chronic. We have a lot of diabetics who have depression, and some who are addicted to. And so you've got to balance all 3, and then you bring in law enforcement. So the commission is to be commended for taking on, they've been meeting for 10 months now. It is a commission by the mayor and city council who are totally committed to looking at this issue. And what Manuel said is looking at the gaps. That's one thing they did in surveying everybody and updated, because we found out that even among them, people didn't know who was doing what. And so we're about to make that public after all the stakeholders updated it. Everybody, we went to SCAN, Border Region, with CARE, AMA, every single provider that's here, and then ask them what are the gaps. And so later on in the item, there's certain discussion, because some of the gaps was, one, making sure that the continuum of services are done, And maybe not just by one person, because no one agency does it all, but connecting all the agencies
Right.
together. And then looking for resources to fill the gaps, because there's never enough resources. And definitely partnering, one of the things that we're monitoring between public health and law enforcement, what are the new things that are coming out? Then we found out that we've been monitoring e-cigarettes and synthetic drugs, Chitoras and us, for years. And one of the things we found out today, that youth are beginning to experiment using e-cigarettes, but laced with marijuana. And the way PD found out that, because they arrested them for mischief and then tested and came out positive. And so we're monitoring what's also on the verge. Fentanyl is a synthetic heroin. And so anything that's synthetic, we're concerned from the healthcare side, because we don't know the dose response. And so they'll overdose. That also the agenda, but Madam Chair, I'll share that we updated over the last 6 years our deaths by overdose. And it's up to now 190 deaths, with 175 due to heroin. Ranging from ages 1 year of age to 72. So it's all ages, all spectrums.
What were the ages?
The last 5 years.
1 to 72.
5.5.
One.
1 year. 1
1.5,
year.
100 and some, and 5.5 years.
In 5.5 years, 190 have died by overdose. 175 were opioid, heroin mostly. And so we know that there's a problem. And in 2017, we had the highest with 43 dying of overdose. The average per year is around 30. For our population, it's too many.
Yes.
No one should die, we should, of overdose, but for our population, based on national statistics, we should have a handful. But we're having about 30 die per year. In 2017, for some odd reason, it was 43 people who died of overdose in Laredo County.
Could be the availability, it's easier to get here.
But do we know what, it was all heroin, or was it there were other opiates?
No, they're mostly heroin, but there were other opiates, but mostly heroin, fentanyl.
According to the presentation that Officer DA Agent Reese was talking about, they started mixing heroin with the fentanyl.
Yes.
And of course, the addicts don't know what the reaction, and they're used to a certain dosage, but then they're multiplying it, because you put it in terms of a grain of sand and how much that, like how many grains it would take to kill a person. And it was very small amount of fentanyl that could kill a person.
And that's the ongoing evaluation on the medical and science side. What will it take to overdose and die? Because we don't know. But certainly one of the things we're finding, and the police department is analyzing the data, because that's a good question. Was it just heroin, another opioid? But half of the opioid deaths due to overdose, they were using both heroin and cocaine. And they counter each other. So one of the first thing on the medical side is they're gonna go into respiratory arrest and a heart attack, and that's why they die. And so you have antagonists. The cocaine is an upper and heroin is a downer. And so that upsets their physical health as well. Needless to say, everything else. And so we're looking at that, but we appreciate, and I think this commission is exactly wanting to hear from the programs to tie everyone in, because it is a continuum of care, and making sure that we fill those gaps. And one, we don't have a detox center here. We're glad that SCAN is probably the only one doing transitional, because that was a big concern from the commission members, and we need more. We're glad SCAN is doing it, but is it enough? And so your question to Pillar, what's your capacity, that's
Well, we just started a
important.
project, so that, but I think you bring an interesting point that I wanted to ask you guys, because you've been meeting quite a few times. Has there been a way to say, well, these are all the resources, Water Region, we have Gateway, how do they connect? So then, because has there been like a comprehensive plan, or how do we link services?
That's what the commission is looking now, because they've done a needs assessment survey, they've updated a director of resources, now they're looking at the gaps. And one of the first things the commission members said is, how do we tie everything in? Besides going for additional resources, and that's why all of you at the table is so important. This commission invites all the stakeholders at every meeting, because we wanna hear from you.
Can I offer a suggestion that perhaps, I don't know, in a regular meeting or a separate meeting, that we all kind of look at what's out there, and then how we can
Like a
make them together,
workshop.
because, yeah, because like you were talking about, co-current disorders, and I thought, thought about our COP-C program, the strong case management that links into you, and so we have, a bunch of things that we can integrate, and
Yeah.
if we don't know, if we're not aware, we don't know how they
Exactly.
connect.
I think that's what we discussed a couple of months ago, where we
Right.
wanted to do a Wednesday afternoon, but more so like a Monday during the day, lunch,
I think it'll be
afternoon,
great.
to bring all the stakeholders in to present what you all have, what programs you have. We jot them down and we start putting them, whether it's a preventive, whether it's an aftercare, whether it's, and then we start putting them into its category.
From prevention
to
all
be-
the way to aftercare.
Yes,
yeah.
because then that actually helps nonprofit organizations or any of the resources that are here, the stakeholders themselves, to start, communicating back and forth or making those referrals appropriately, because I think through the years, it's been where, send them to a particular agency and they,
But
it's
we-
not.
We know that referrals
they're
don't
not
work, we have to
productive.
go over there and kind of make the
Yeah.
connection for the
Which
client.
brings me back to Judge. I have a question, and because now I'm curious, and I would love to see how Francisca comes out and how well she does, and I want to follow up with her, because I think giving the opportunity to somebody, giving them the benefit of the doubt. Here are the resources. We're providing it for you. It's costing the organization's money, or you're giving her that benefit of the doubt to do well. But you said there's already a flaw once she goes home. Is there anything that the court puts in place, or that allows you, to tell her, you one more time and that's it? Or is there what is it that the court does to prevent her, give her that will to, I don't want this for my life. I don't want to get in trouble. I don't want to go back to jail.
An incentive to continue the program or to
Right.
follow through.
Well,
Like,
and-
what happened? What is it that the court can mandate?
And like I said, this is a work in progress. Francisca was our pilot, so to speak. But what I can do is, for example, let's say she's got 10, and what I'm gonna be doing in the future is, let's say she has 10 cases, right? I'm gonna leave one open. And I'm gonna say, look, you're gonna dispose of these 9 thefts, right? But you're gonna serve a year, you go through the drug court program, you cut that in half. But I'm gonna leave that one case pending. And then I'm gonna say, you need to go through the aftercare program. And that forces her, because that other case is still pending. And if she does not comply, I'll give her the maximum, which is 6 months, or if it was a class A misdemeanor, a year. But I didn't have the foresight to think about that in Francisca's case. So we kind of disposed of all the cases right then and there. But I think from here on out, it will be one case that'll be left pending.
Yeah, because my concern, I think, is that you mentioned that she's going to a home, after the aftercare, going home to her husband or partner Rocky, and he's in a situation similar to hers. What then stops her from having to reoffend or begin the addiction again?
Now, that is a concern, but Rocky is incarcerated. And while Francisca may be eligible to be released within the next couple of days, he is not. And I need to make sure that either
He
Heidi
follows.
or somebody else goes and talks to him.
And where's the son?
The son's in at juvie. But hopefully that'll, seeing his mom clean and sober, maybe for the first time in his life, I don't know. It might go ahead and inspire him to kind of do it. But I got sick and tired of seeing all these poor individuals just going in and out of jail.
Well, I think it's a community effort, and I think putting the pieces together is I'm actually enjoying the fact that, you know, we're putting the pieces together. I think one of the most important things after the scan, the aftercare, is getting them into the workforce and giving them the opportunity to go work, you know, just like everybody else, and be
Yes, the
productive
skills.
citizens. So I definitely
Software.
commend you all for putting the work in and piloting it with this one person, and then hopefully there's many to come. The only expectation that I think that I feel is, you know, to just make sure that, you know, we follow through with all of them, that they're not reoffending, or that they don't fall through the cracks again, that there is something that prevents them and says, here, you know, we put all our resources together, we put it out on the table, we gave you all of our attention to make sure that, you know, that you do well. But then at the end, you know, it's just, it's their choice.
Now, here's what I'm hoping happens, because, I mean, let's face it, you're telling an addict, you're gonna serve a year in jail, and they're like, I don't wanna be in jail for a whole year. And they may willingly say, well, I wanna go and get some help, you know, I think all of them do that. But, gosh, very few of them are actually very sincere when they say that. And so it's difficult, you know. The difficult part for me is that I piss off the defense bar. Because here they are, they made an agreement with the state of Texas that all of these cases will be wrapped up for 100 days to serve. And guess what? She already has 100 days credit. You know, so was that punishment enough for 10 cases? You know, and I have to be the bad guy that says, I'm not going to accept that. Then you piss off the state of Texas, then you piss off the defense counsel, you know, but that's what, you know, I want to help out the individual. I don't want to punish them. And we don't do the defense counsel doesn't do any good for their client if they know they have a drug problem and he's not addressing it. The state of Texas also has to look at it from a deterrent standpoint. 100 days to serve for 10 cases? It's not going to deter anybody. Not when they're already have served that sentence. And so, but I have to be the bad guy, and I'm willing to be the bad guy that busts deals, and, you know, I've been doing it. And so I'm hoping that Francisca and the other lady in there become so successful that it'll open the floodgates, and that other individuals will start saying, hey, I want that program, because it's not gonna come from the defense bar. And it may not come from the state of Texas either. It's going to need to come from the individuals, and I'm hoping that we're so successful that everybody else is going to say, you know what, I also want to change my life. And I'm hoping that that's what happens, because otherwise, again, it's so difficult to convince a junkie to give up a year of his life. You know, I've attended a lot of drug seminars and drug conferences. I know you all know more than I do, but I remember one time that they showed us images, electromagnetic images of a healthy brain, and the frontal lobe should have a lot of red area, which means that the individual is deciphering information and active. And when you see a junkie's brain, they've just got little dots of red, you know. And so when I used to ask my clients, what were you thinking when you stole grandma's TV from her living room? The answer was, he wasn't. And so that's what I'm faced with. A junkie is not going to say, oh yeah, that's for my benefit, I'll go ahead and serve a year in jail. They're not going to do it. But hopefully, Francisca and the other lady will be so successful that they'll want to be a part of the program. Because otherwise, it's a very hard sell.
Will you be offering transportation for drug court?
No, ma'am. They're in jail.
No, after, like, let's say for my daughter, they gave her drug court afterward, and she was worried because sometimes she wouldn't have transportation. I said, I'll take you. You know, I'll take you. She goes, no, well, sometimes, you know, not only me, but other people don't have transportation. And I said, well, I don't know how that works.
No, I think it just comes down to commitment.
No, they're junkies.
Yeah, but I mean, if the person is committed, they will get there.
No, they're junkies.
She will need transportation here in Laredo?
Mm-hmm.
I mean, the guy can talk to you, and she's gonna be released, we can offer transportation.
Oh, right.
We can offer the council can provide transportation, we have case management company transportation. So before, I mean, this company,
Okay.
See,
We'll
these
give
are
it
all
a
these
best
things we
shot.
don't know. We need to
Yeah.
have that big meeting
Yeah.
in your
We've
big
got another-
auditorium soon.
Another component that I think could be more longer term is if you're planning on helping them achieve some sort of skill, even if it's a minimum skill, maybe some sort of job placement program, because it's gonna be very difficult, you know, and then some go-between or liaison that would explain to the employer the risks that come with hiring an addict. And then someone to keep an eye on the addict maintaining that job.
Well, I think SCAN already has something like that.
Yes.
They have like a bond.
it's a bond kind of thing, I don't understand it, yeah.
But I'm
So they
hoping,
can, yeah, protect the employer in case something happens, or, I don't know. Yes, this
Yes,
way.
Yeah.
$5,000 bonds, so
There you
what
go.
happens is whenever they're protected, so they.
Cause I'm sure there's open-minded employers out there who are willing to give
Well,
this a
I
shot.
mean, like, I need to hire people, and it's like, I can't hire anybody, nobody has a driver's license, I can't hire, they can't, my insurance company won't, insure them, you know, they don't have a driver's license, so it's really hard, cause they have to have 5 years of, driver's experience with a driver's license, and so, if you have somebody like that, send them my way.
Well, I think
They have a good, clean driving
your,
record.
is your daughter, right, about?
My daughter.
Yeah, when she gets released, I think the first thing that we need to know is what are basic needs, and then we'll take it from there,
Okay. Basically,
Yeah, we
it's
need to-
transition living.
Yeah.
She can't live at home or her father's home, and then,
Yeah.
so that she can, you know, get the training skills and things like
Yeah.
that. And
Yeah, no, I mean, just, I mean, you know, addiction is a brain disease, so a lot of times they do things not because they're bad people or they're
Right.
junkies, but because they're suffering inside, and
And
a
like
lot of
he's-
times they,
like he said, if they didn't have mental illness before, now
Yeah.
they do, with drugs.
well, what we have seen is that it's always an underlying kind of
Sure.
condition, and sometimes people don't detect that it can be anxiety or depression.
Correct. Oh, and she does. She has
Yeah, so
ODD,
then-
ADD.
So then there's a way that they wanna medicate it and then develops into full-blown addiction. But yeah, no, it's the meeting with Gabby and then getting a plan and then assessing your daughter and then deciding what's, you know, what is the best for her.
and one of the things that we discussed this afternoon, when we left on Mr. Mojica was that, you know, gosh, I went to school high school about 40 years ago. And back then, Martin High had a welding program, auto mechanics, a workshop, and some other vocational training. And I know that some of my classmates went through those, developed enough skill to be able to then go out and market themselves in these areas. And so what I was hoping to do is to maybe talk to the workforce solutions and ask them if they could provide that sort of training. Because, you know, getting them a resume, and I give my dad as an example. My dad was a truck driver with a 5th grade education. If he had gone through the workforce solutions and they told him, well, let's work on a resume and let's work on this, it's like, you know, Jesus is not gonna do that, okay? Because he had very limited skills. And so we need to be able to give these people those skills, you know, because they may not be college material or high school
But
material.
the schools need to hear this.
10th grade, yeah.
The schools need
Yeah.
to hear this
Skills
because
are needed.
they're doing away with those
Yes,
programs.
they need them.
And we don't have the auto mechanics, and they had a very good building
Yeah.
department where they actually learned to do carpentry and stuff, and
Yes.
that's gone. Basically, it's hairdos. What is it at Nixon? Cosmetology? What do you do with that?
Well, that's what my daughter was doing, but.
Not the boys.
Not the- well, some boys, but,
Not the
yeah, but we
boys.
need skills, plumbing,
Yes.
electrical.
And they make a lot of money. Try welding.
Well,
Yeah.
you
I
know,
know. We
truck
need-
driving to drive, you know, whatever.
So I don't know if we can partner up with
Data
LC or, you know, some other, I don't know, some other providers out there.
Even businesses like ourselves that are willing to train, like, we'll train you to do data entry, you know, and then, you know, something, I don't know,
Yeah.
some type of.
Get a certificate if you're related to LC or whatever, you
Right.
know,
Mhm.
work with the businesses. Because I don't know if Laredo College would take people if they haven't graduated from high school.
No, you need to get your GED,
And that's another problem.
That they.
I worked on a grant with the sheriff's office and GED, and it's very hard to get these kids through it.
It's very.
But aren't
It
there
was
some
pulling
continuing
teeth.
education programs that forego the high school, whatever, it's just to
Just
get
skills,
certified?
training them with
Right,
skills,
Yeah.
yeah.
yes,
That,
yes.
that might have to be.
Well, but we all have to get together.
Yeah, we just have to plan the day that's good.
And including the judges, so that they can hear it from them.
Because, well, you all are the ones that
Not the
know all the
peons.
weird cases out there that need
Not all.
attention, yeah,
But I think
Not
if you
me.
give an individual a skill
yeah.
that he can then market,
Mhm.
you give him a sense of pride, you help his self-esteem, and then he can
Yes.
start going about and providing for his family. And so I think more than anything,
Self-worth.
that's probably what we need for a lot of these individuals.
Just
And
plain
so-
old love, like she says, all of us just need love in here, we're like just totally in the dark and everybody's angry and, you know, we're the whoever, some of them are on a power trip, some of them are super nice, the guards. Some of them are really nice, and that's just, you know.
I think the key term here is the self-esteem.
Self-esteem,
This is one of
self-worth.
the issues that your daughter has with the blemishes, because she's so self-conscious about it, because it affects her self-esteem.
And it was already affected, obviously, that's why she's ended up there somehow, you know.
Yeah, but in the rehabilitation
Correct,
process, in the
that'll
story,
help all of
yes.
them, you know, because they're already marked, they'll say, I'm worthless, I'm marked. You know, I'm never gonna be worth something, so we can do something, that would be great.
Yeah, program like this will be beneficial.
Well, I think this was a really successful,
Discussion.
discussion, right?
Yes, thank you so much,
Thank you.
Judge Martinez.
Well,
What you're doing.
and,
Thank you,
Thank
Bill.
everybody
Thank you,
because,
Scan.
because, I don't have anything. You know, I just had the people who I could refer to, and it was Manny who stepped up to the plate, and then Scan stepped up to the plate, and then we brought in Workforce Solutions. So everybody's is coming together, and God willing, we'll save one or two of these individuals. You know, and it's like I tell the people, give me 6 months, and maybe those 6 months that you give me will fix the next 50 years of your life.
Yes.
You
Because
know?
they haven't been sober probably for a year, in years.
That's exactly right. Yeah,
From
because
16 to 26.
it's like this individual Mauricio that I told you about that got arrested 56 times. Unless he's the most unluckiest person in the world, you know that he committed a lot more
Oh, God,
than those
yes.
56 crimes.
Yes.
He just got caught 56
Got
times.
caught 56 times.
That's what I
Well, Judge, thank you for sharing this program. I was curious, we have that directory. Is there a contact person that we could reach out to when your program is more defined and add it to the directory? I think if we added that program, we could also add the DCP program, which I'm no longer affiliated with, but.
Oh, okay.
But, and the DWI program, the MHMR program, I think if we had these in that directory, maybe we could, make it even more useful, and maybe the defense bar could start looking through the
That's where
pages.
we're looking at the gaps.
Yes.
That's what we're trying to find. Yes, very good, yes.
Yeah.
Yes.
It's
Thank
gonna
you
be
so
my
much.
criminal coordinator, Jeremy Koss.
Jeremy Cross.
Jerry McCoss.
Jeremy Koss.
Oh, Jeremy.
Yeah, C-O-S-S. I don't know his phone number, Jerry, I don't even know the office phone number.
His phone number, do you need his phone number?
Yes. Phone
It's
number.
523-4341.
It's a number that we publish.
Yes.
523-5341.
No, 4-3.
523-5341? 4341.
When do you think you'll have some more definition as in how the plan is gonna go? I know it's in its pilot stages right now, but, is there a time frame for, when you're hoping to review it and finalize your, plan of action?
Well, hopefully maybe within the next 6 months.
6 months or so, right? We
Right.
still are going back and forth with a lot of different ideas of how to expand on it, but we'll certainly be sharing it with this committee.
But certainly now we need to have the scan component for the aftercare.
And Workforce Solutions was already part of the package.
Right.
Email you so you can send us the information.
Yes.
They
We
would
just-
sign it.
We just need to, I think, hopefully add that component for vocational training.
Of course, which is where workforce comes in.
Right, right. Let's see what they have to offer.
Of course.
So we'll
No.
email you so you can send us the contact.
You know, of course, we're talking about people who have already been through the system a lot of times and who have an extensive criminal history, but there are a lot of junkies out there who don't have criminal histories, and I think that's what we need to start addressing.
Can I offer a suggestion? I know that I've been talking quite a bit, but, I know Jaime Lispe was, the one who led, a group of different agencies, and we looked at a specific case, and all the different agencies come together, and then they see how they can develop a plan to help this person. And the more difficult, more complex cases, I wonder that would be something that we can do, that we have a person, and then we can look at, we can get Puerto Rican
Custom,
scan, we can get.
custom tailored.
Yeah, kind of a wraparound kind of approach.
Multidisciplinary.
Multidisciplinary kind of team meeting, and then we can decide. But maybe just throwing that to see if it's anything that.
Now, here's another thing, another idea. And I don't know, I guess we would have to talk to Workforce Solutions, but are there monies so that perhaps maybe we can offer to Francisca to go out into the jail and talk to these people and inspire them to enter the program.
Peer-to-peer
Or like
projects
my
are
daughter
usually
who's
very
coming out
successful.
in 45, she's already a year clean.
Yeah, and a lot of us want to help these individuals, but a lot of us, or maybe all of us, haven't walked in their shoes. And it takes somebody who has walked in their shoes to really get to them.
Yeah, but I don't know about money, maybe incentives in other ways, like tangible things.
Yeah.
Not money. I don't know.
Well,
Tempting.
she needs to start working to
Yes,
support the family.
That's true.
And so that's why I was thinking that, I don't know.
I would pay a month's rent or, I don't know.
Project, incentivize them to get
Incentivize,
involved.
right.
Mhm.
Right.
Yeah, because I think she would do well to go out and talk to other people.
Mhm.
And that might give her the self-esteem that we were looking for, of course.
Right.
If you think of a lot of success stories of people that have beat their addiction, they do get involved in
Yes.
peer-to-peer support services to help others, and usually those are very successful. We've used evidence-based interventions that use role model stories of people that have gone through certain circumstances, then have really, had successful outcomes. Then they share their stories to motivate others to follow in their tracks as well.
Right, in fact, she said she does wanna get her GED because she wants to become a drug counselor, cause she feels that she can help others.
So that's a great way.
So that's the premise for AA,
Of course,
and that's
it
been a
is.
successful program for years.
Precisely, good point.
Okay, well then we're going to continue, please, with, we already got the stats from Dr. Gonzalez, so we'll jump to letter C and search for funding to address this crisis. Detox center and transitional rehabilitation.
Madam Chair, yeah, we touched a little bit on it, and just in the overdose, we're doing a flyer for you, so we'll get that to you. You had asked, the commission members had asked for us to start looking at some of the resources to fill the gaps when you did the survey in the directory. We called Health and Human Services, because they were awarded $46 million to address the opioid crisis from CDC and HRSA. Then the state has $20 million already budgeted. We were glad to hear that some of the money is going to be dedicated to the cooperative agreements they already have with local partners. Aquí en Laredo, one of them is SCAN, so that's great. They're going to get additional resources. But we asked them, then how else can we increase more? How can we support more of Laredo's community to look, especially filling the gaps? She did say there's no money for brick and mortar, but there is a lot of money coming down that they're gonna target for prevention, for treatment, for training first responders on how to address the overdose with naloxone, which is something that we've discussed, the commission members have discussed several times with the stakeholders. That we were very surprised that AMA was just beginning to train their own staff to use naloxone spray to prevent overdose.
Dr. Gonzalez, I could interject, because we just started a pilot project. We did receive some funding to start a Narcan
Okay.
We're gonna conduct a training very soon to be able to train those that wanna be part of this and to show them how to administer it. We're also gonna provide them with a Narcan medication as well.
You see, and those are the things that I think are beginning to be done. I know Scan announced, Ms. Dabdub was here announcing the new grant that they also on the task force to train first responders to address the, an addiction, a person that they're approaching. And that's it, so all those things need to tie in, and it's good to hear that. So we were asking them for additional, what they informed us is, and we're gonna have a conference call with the chair, we're gonna invite the chair. They're gonna pull in all of the state 20 million and the feds 46 million. And apparently they're going to do RFPs, they're gonna do grant announcements, but they're gonna partner with the universities. They want the universities to be the main group because of the evaluation. These are all evidence-based efforts, so they gotta have a strong evaluation component. And they're not gonna do this until January. The second reason they're waiting until January, they wanna hire a physician on the medical side to work with all of the state agencies to make sure there's no duplications. Because I just said Health and Human Services Commission, but the state's Department of Justice, the state's Department of Housing, also has money for addiction. Most of it is for prevention. Most of it is for addressing some treatment. A lot of it is not for residential, a lot of it is not for transitional rehabilitation, definitely not for brick and mortar, for detox centers. So we'll continue to look at the federal level, there are some monies coming down to the Department of Justice. But there's also training, and that goes along with the next bullet where we've discussed about sensitivity training for first responders and law enforcement, so they know how to handle someone who they're arresting with addiction or they're dealing with in the penal system. So as soon as we get more data on the meeting with them, because they definitely were interested that Laredo has a drug and alcohol commission, because they want to hear from the public. But I think it's a good plan that they have in hiring a medical officer for the medical side of it, and to make sure that among the state agencies, there's no duplication. This agency's gonna do this agency's gonna do that. But Health and Human Services has $66 million to address the opioid and addiction problem in the state of Texas. That's probably not enough, even though it sounds like a lot, because of the discussion you have had here already of the intensity of the different phases that you have to address. But I think a big thing is the training. A big thing is beginning to roll out naloxone use to prevent overdose deaths. And that's a big savings in using the spray versus our EMS are trained but use it IV push. You don't need to use IV push on every overdose. But that comes along with training. So soon as we have a meeting date, the commission members, we'll let you know, Madam Chair. They were very, very interested to hear. And then they were also very alarmed when I gave them our overdose death rates.
That's something we have to keep bringing up to them, that we have a way higher than average.
For our community,
Yes, for
that's a
our
big
population.
disparity.
We
That's a
already
big
have
disparity.
With
over
no help,
100 kids.
We're left distracted.
We already have over 100 kits of the spray, so any
Okay.
agency that wants to be part of this training, let me know. And of course, we don't wanna get people that have family members that are intimate drug users, that they can also be part of this training. And after they complete the training, we'll supply them with a kit.
From the Centers in Disease Control, the priority for naloxone training is the family members. Because sometimes they don't know what to do, so they call EMS, and sometimes by the time EMS
Sometimes
gets
it's
it,
a-
it's too late.
You
It's
will
too
provide
late.
the spray?
We're gonna provide the spray, but of course, they need to undergo the training with us.
Sure.
No,
And so maybe there will be a way that we can, make the family members available to, if you have.
It's for the families, taking the families,
Yeah.
and if you need a certified trainer, I'm a certified trainer. I took the
How much do you charge?
You're hired.
Chief, I don't know if you have anything to add, these two items on the agenda, sensitivity training and the resources.
Well, any training is, it's a bedrock for law enforcement. Any training we've gone through, sensitivity training, or what we call the crisis intervention training for, mental cases out in the field. This is a new trend to train officers how to handle drug users and addicts out on the street. We do that on day in and day out basis. Usually at downtown, usually at places where they go under the bridges, culverts, and they shoot up. But going back to the training, whenever there's available, and just listening to Taylor over there with that training, I'm willing to, commit officers to be trained to dispense that drug, just in the event that they might run into a person that's already coding, because what we do as policy and protocol is refer to the fire department EMS, and they'll dispatch an ambulance immediately. But nonetheless, you never know when it's.
So when they have the spray, they can,
Yes.
because it may take too long.
We need to move with
At
the
least it's not
times.
the needle anymore that they have to.
Yeah, we need to move
Yeah.
with the times and, start.
I think it'll be great if we can supply all police officers with narcan.
Mhm.
I see having that,
And we talked about that at the beginning,
Yes.
maybe number 3 or 4.
Yes.
thing. So, funding is one of the main issues, but training, and I'm saying this again, we not only serve and protect, but we're also the first responders. Police usually gets there before anybody else.
Correct.
So, before EMS, and EMS usually asks police, is it safe for us to arrive? I don't know if you heard that
Yes,
one,
yes.
but,
Yes.
so that kind of, delays the response seconds. So nonetheless, just coordinate the training and follow through. The sensitivity training is, we're going through, as we speak, the active shooter
Yes.
issues that we've seen across the nation, in the local communities are asking for some sort of trainings and seminars from the law enforcement.
Can I give a commercial?
Commercial.
We have a 3-year grant with SAMHSA to provide mental health, it's called MHAT, mental health awareness training. So they would be safe for first responders. So they would use a curriculum called mental health first aid. It's not only mental health, but also covers substance use disorders, not the overdose prevention. And then, but the idea is that you would help people recognize mental health disorders and substance use disorders, and then link what to do and how to link them to community resources. And so yeah.
Yeah, send me something, we'll make it happen.
Right, and not only for, and the benefit the community in general, so.
So that's my report, Madam Chair.
That's wonderful. Well, we're finished with our agenda.
Yeah.
Surprise, early. That is a surprise. Staff and stakeholder updates?
Some of
Everybody
them
gave their.
have, Madam Chair, but I don't know if anyone else has any other updates.
Well, I just wanna mention something to everybody here. Pillar's having its 2nd annual mental health symposium on December the 6th. We are offering CUs. We can email flyers to everyone, please inviting everyone to attend. We enlisted a lot of dynamic speakers to talk about substance use, the opioid problem, general mental health issues. So we would be very pleased to see as many people from this commission be part of that, and our community partners as well.
December what?
If you can send me
December
the
the
flyer
6th.
and we'll get it out
Yes.
to all the stakeholders.
We'll send.
Is it in the evening or in the day?
It's all day.
It's during the day, yes.
December the 6th.
Yes.
6th.
And I believe we may have already sent it to you, Dr. Gonzalez, so if you can maybe send it out, now we'll resend it again. And there'll be food provided as well, and it's at the IBC on Jackman, and they're very good when it comes to catering. So bring your appetites.
Tamales.
For you, Chief Tamales, right?
Pero está dieta, ¿no?
Sí, son de dieta.
That's right. Sí, son good, yeah.
Madam Chair, do we have any news on, or any plans, what's the next step, I should say, on the detox center discussion?
If I may, Madam Chair, we're compiling all of the recommendations, and we did send you a few bullets on the different input that the stakeholders gave. And the major one was a lockdown, which you have to commit a crime to a social medical. And that's why we're touching base with the different agencies to see what kind of resources are available for the brick and mortar. We had, you had the judge here as well, and the sheriff, a potential place that they had that may take too much to rehab. I think the commission's on the right path of looking at every opportunity to see what we can do, including looking at resources. We need to bring back all that information to you so you all can have the discussion of exactly what you're saying. Mr. Thompson, is what are the next steps?
Do we have like a time frame on that by chance, just so we kind of have a broad idea?
That's up
You
to
had sent
you.
us one. I remember that and I sent it out. He had sent something at his idea of what we
I
should
think
do
it
in
was
September,
for-
November,
Yeah.
December,
Yeah. I
and
think
finish
we're-
by January.
We're about due.
But it looks like we had a hiccup, and now we have to gather some more information and
Yes.
get it back on track. So I was just curious as to when, how much time we should.
You all had said to take a definite look at developing, constructing, getting funding for a detox this month. So you're on track, but we because of what you asked us to do, we're looking at that, at resources. You got experts here to say, you were looking at definitely a potential of the county donating a physical place that used to be a detention center, and while it has possibilities, I think
We need a
the folks
plan.
told us that it has to be rehab, and
Too much money.
it may take too much, so start from scratch. And so you're on the path. I think you need to have the frank discussion, and as we've shared with you, you don't have to wait till the last meeting to discuss. You can't take an action until you formally meet, but you can take,
just discuss.
but you can discuss and share and exchange ideas,
And I
and you've been
still
doing that.
would like to do what was Colleen's idea a couple of months ago about let's get together in the auditorium and get everybody together and write down what exactly everyone is doing, what is missing, actually get it on paper.
Well, I thought we were gonna do like different groups, like group A is gonna work on detox, group B is gonna work on rehab, and group C is transition living. But we need to get the groups to do.
Madam Chair, those are the different action items that you all need to decide, are we gonna do one mass, or we're gonna break up into subgroups to look at the different,
Cause otherwise it'll take too long by the
but
time we do anything.
the other thing is a public stakeholder meeting that I think is a good
Yes,
suggestion.
that's what we need.
You've already surveyed all the groups, and they've done. Now you need to report out to the public and hear from them as well, are we missing some things? And then there's new updates even now to the survey because of the new programs that Pillar and Scan have.
Well, everything's in the directory.
Everything's in the
But has
directory.
anyone sat down to say, okay, these are doing this, and these 10 are doing this, and these 5 are doing that? No, that, we need
That's
to
what
do
we
that.
need a workshop for.
That's the analysis that right now we had the interns doing from West Care, and then they finished. It turned out to be a lot more, and they did a great job with the directory, but then came the analysis, the gaps. And
The
the
statistics.
survey said that. The
Mhm.
agencies are telling us, this is what I see as the gaps.
Mhm.
Do we
We
have
just
a
need to
place
do-
in mind, like somebody mentioned somewhere in the base to build something?
Well, that was mentioned also as a potential. Now you all have to sit down and develop
Does
the
anybody know where
action
at the
plan.
base?
No, they just said the potential is real estate and at
Mhm.
the base, but there was nothing specific.
Okay, so,
You do have a plan that you all develop timelines, you're fitting in. I think the next discussion point is sharing, again, finish the analysis of the resource directory, add the new additions, that primarily Pillar and Scan have new programs. Gateway, that's a new program that's not in the directory, so we need to add them. But more importantly, your survey. You have to analyze and say, this is what the stakeholders are saying we need, this is what we're doing, and tie them in at a public meeting so everyone knows, because I think the public needs to know. Ms. Dabdu shared that people didn't know all the services Scan was offering, and they had to outreach to folks outside of Laredo. People need to know what's here.
Sure.
The public needs to know what's being
All the
offered.
attorneys
Your public
need to
meeting.
know, all the attorneys that we
The
hire,
courts.
And I think one of the ideas, and I was jotting it down as everybody was talking, but one of the ideas that I may have, and it just may have to be something where the courts agree, it is, I was going over the agenda minutes from the last one, and, the duplication of resources that we
Yes.
potentially do have. I think one of the things that we need to do is obligate our stakeholders to report, on a monthly or on a quarterly basis, to see if there are any updates, to see how their services are going, but something maybe perhaps like in order for them to get through the courts or the court's referral, they need to be part of, something like the Chamber of Commerce, where you're a member of the Drug and Alcohol Commission, you're required to come and report where you stand and what services you're providing, like give a
Correct.
report of something. And then from here, we provide it to the courts, and the courts then say, they've done the work, they vetted it, they have all the information, then these are the agencies that we're gonna work with. Because then, we do have, again, the duplication of resources in our community, that you have your mom and pop, agencies that are just starting off, may not have the resources, and then that's where we have the gaps or the cracks that, things may occur. But I think primarily, the public workshop or the public, meeting to have it where
That's what we
we structure it similar to what we have here. They come in with a public comment, Scan, Pillar will come in for a 10-minute presentation, break down all their services and where they fall into the categories that we'll have, from prevention to aftercare to rehabilitation or whatever the case may be, however they are, best distinguished. But to go through it like that way it's not, because it has become very time consuming, and it is time consuming. But I think primarily what we need to do is we need to get out in the community and say, these are the services that are out there, and, this is how you can get the help. If you fall in, again, if you fall in through, the justice system, you have to go through this. If you are out there and you still haven't gone through the justice system, there are resources, and this is what you have. It's a chart. We have to work with charts so that it's easier for us, it's easier for the community, it's easier for a parent who has a child who may have a problem, what kind of problem are they going through, and then just distinguishing it through there. But I think we need to get through that.
Madam Chair, then maybe your schedule for your next, you meet every first Wednesday of the month, for your December meeting to be a brainstorming meeting of yourself, the commission members, to build this public forum. You've heard a lot from the stakeholders, you've updated a directory, you've done a needs assessment survey, but for you all to look at what you found. And so for that you all need a working session. And then have the public, I think that's very important, that the public know there are resources here.
I won't be here on the 5th next month because I'll be in Houston for a training, but I most definitely can phone in and be a part of it.
That's up to the.
It's the Campus Crime Stoppers. We just started Campus Crime Stoppers at UISD, and they're
Yes.
having a 3-day training out there, and it's something that's very important that I cannot.
Yes, but no, we can't have it without you. It would have to be another day. You'll be gone, what, 3 days?
3 days.
And you have that option, we would just have to, because this is a public meeting and it's posted, we just need to know what day you choose, so we can post that.
Would be
Well,
Second week
I
of the
move that
December?
we postpone to the second week then, so
Yes.
we can have it here.
Is everybody available for the
And
second
that
Wednesday?
and that
What day is that?
I also had to put it on here that we get the commitment, that we set a date, that we put a commitment where everybody can
Here for
can
sure.
be here, and that we
Yes.
schedule the stakeholders so that we don't waste anybody's time, because
Mhm.
everybody's time is precious. But that we schedule the stakeholders to come in from a certain time frame, and we respect that time frame so that they can come present, and then they leave, and then we start with the next one. But that way that it's scheduled.
Unless they wanna stay and they're welcome to hear what some others present, then they could stay, but you have a time
I
and,
would love to present
mhm. And what's, what, and,
So Madam Chair, is the 12 and commission members, the 12th of December?
mhm, yes. Cause I would be out the first week of December too in Austin.
Mr. Thompson?
I'll be here.
Okay.
You know, got some my wine tasting glass.
Now, what about time frame for this?
You can also adjust, we'll consider this a special meeting, so the time is up to you.
Can everyone get off work? I don't.
I mean,
And
I would think something, I don't know, if
That's
that
on
would
a
be,
Monday.
it's a, the 12th is a
No,
Wednesday.
No,
I'm
it's a
sorry,
Wednesday.
It just depends how's court with you, Mr. Thompson,
Okay, that's a
on a
Wednesday.
Wednesday.
Would you know that far ahead? No.
I mean,
Could we do something as early as like 1, 2, 3 o'clock in the afternoon?
Or is it better for you in the morning? To
no,
meet.
it's a
It's the
grand jury
afternoon.
day, so
Oh,
definitely the evenings.
Evenings. Me
Well,
too,
again, this
it's
is your
kind of better in the
brainstorming
evenings.
analysis
After
meeting,
work.
so
3 o'clock is the earliest, is what you're saying?
For me, I
Pushing.
think
he said evening.
3 to evening.
Oh, 3 to evening.
3 on.
Okay.
But we can tentatively set it for 3 o'clock and then
Yeah.
have the
And brown
availability.
bag it because we're not leaving.
Okay. If we wanted ever in future meetings to talk about something, do we call you to introduce the item? Okay. Are they
But,
available?
but also it's a public meeting, so you are guaranteed under the public comment 3 minutes.
This is the
But if you do a formal, if you're in the agenda, then you do, it's a formal. And everybody has presented, but if you wanna present again, absolutely,
Okay. So then,
three, under the public comment.
Okay.
But
But
if
if we
you're
wanted to make it-
presenting,
Okay,
then
yeah.
that's, you make your
Oh,
presentation.
okay.
If you're in the
Okay.
agenda, you're part of the agenda, you don't have,
Then I have to tell you,
You'd be able to help me out.
Madam Chair.
How do we, cause I won't know, but there's a chart,
Okay, well
right,
then we've set up for
from
December.
prevention to.
Because we need to get that one done before we can
before
bring
your
the
public
rest.
meeting, yeah.
When
And
you're
that's
saying-
on, that's on top of the regular meeting, the first?
No, that's
No,
it.
no.
In lieu of.
Oh, okay, okay.
When you're saying that one, are you talking about the directory or are you talking about steps towards the,
Workshop.
Prevention,
towards the
services.
detox?
It would be all of it.
Oh, it would be both, a workshop and a meeting?
Well, for just us, us.
For the December meeting, what's being proposed for you all to look at your directory, yourselves and the survey and analyze the outcome of that survey and your next steps.
Perhaps could y'all have everyone in the committee email the latest copy of
We will,
these items?
we will.
To
Weeks
us.
in
We have to
advance,
update it one
if
more
possible.
time, and Andrea's here to
That's what
do
we're
the
waiting
updated.
for, yes.
She had just sent it out again, but today we heard about Gateway's new program, their new program, your new program, so we wanna update it one more time and send it out to you.
And
Now,
sit down and
when
go
we-
through it before we meet.
When we update it, just so this directory could be more of a help for the courts and the defense attorneys and the prosecutors, could someone contact Jeremy Costin and just get a rough draft of Judge Martinez's program? And perhaps somebody could contact Judge Hill's office for DCP and I'm assuming Judge Villarreal's office for DFI court. He has DFI court and Judge Johnson's for the MHMR court, which touches on drugs.
If you can email me those, Mr. Thompson, and then we'll touch base with it. And then the other thing, you got an email from me that you all developed the Facebook page, Mr. Lozano and Ms. Rodriguez, for the commission. We need to make it more proactive. You all have done a great job, so we give some suggestions to making sure one of them, the Facebook doesn't link the directory. So we gotta link that. So we're working on that as well. And it's a nice Facebook page.
Well,
And
It's very good.
it's easily Does everyone know
I
that the
like it
commission,
too.
yeah, it's a nice, but like we need to link the directory, that's, it's not linked right now.
And one of the goals in mind for the Facebook is to start highlighting on the services. So with that workshop, or that meeting that we'll have, I'm wanting to learn more about what Pillar provides and what the services cost, or if there's insurances and things of that sort, because then what I'm doing is turning it around and putting it into a post and then sharing it. But most importantly right now is what we're trying to do is acquire the likes so that there is, or the shares, so that there is more viewership, like there's people that are viewing it, visibility. Right now I think Mr. Lozano had started it off and he shared it to a couple of his friends, and I shared it onto the Laredo, Crime Stopper page, and I asked, our followers to like the page, and so we had to increase a little bit. But the most important thing is to just keep it active, to put out, and highlight the services that we have. I actually wanted to take a picture of you guys, so don't move. I'll take a picture and I'll put it up there because it's just something that needs to be put out. Additionally, for October, the Drug Awareness Month, I put up some information where it started, Red Ribbon Week. And then I did put a contest which completely flopped because we don't have a lot of people on there. But the idea is to get more people updated and aware news and things that are going on locally that affect us. I actually wanted to put up a survey to see if we could share it and get the community to start, but it just might be a hot topic to put either what is it that they feel that they need, a detox or a facility, what is it that their needs are, and get the conversation out there. But I definitely do recommend that we go out into the media to set meetings to KGNS Univision to talk about our progress, to talk about what we're doing, and then maybe that just might increase a little bit more awareness. But don't go anywhere, I'm gonna take a picture.
And link up to all of them, like to the health department, to the, I don't know,
That's what we're gonna do.
to everybody out there that we can link up to.
And all the
We're gonna
stakeholders.
link the Facebook page, in the city's webpage.
Colleen, you're actually a member of the board.
No,
You're a volunteer and somebody else.
I
Now
know
we're
we
using makeup, so I'm okay.
Well, that's why we definitely want you in the picture.
No, go ahead. Everybody look this way,
Andrea,
please.
no. Please,
Yeah,
Rodriguez,
no,
you're a
I'll
council
take
member.
a picture and then y'all can take a picture.
Okay.
Ready? Whoever's in the pictures. We're good.
Andrea, can you take
You didn't count 1, 2, 3?
No. Everybody looks natural.
We didn't get to smile.
Smile at three, we were like.
I don't even know if I can
Everybody's-
right?
Rodriguez can come out.
No, vamos a salir todos.
But I'm open. I guess I'll pass my email again to Dr. Gonzalez. If any of the stakeholders, Gateway, I would love to have information, flyers, anything that can help, because I can literally sit at my desk and I can research all day, but I do have work to do. So, so if you can send me that information, it's easier for me to just post it up there. And if you all have Facebook pages, please feel free to share it, pass it along and like it. I do, for the Crime Stopper page, I usually do like I tag scan for whatever is going on. I do share some of the events that Pillar has had on our page, so that's what I'm trying to do with the DAG page. I know that Arnold had put the City of Laredo emblem on there, maybe having a drug and alcohol commission logo that is specific to us.
Right.
Maybe that can help with the directory, the marketing and publicity.
I think that's a great idea.
Yes.
Remember, we shared that one meeting, several of the cities' advisory boards, commissions do have their own logos. For example, the Mayor's Blue Ribbon Committee for People with Disabilities developed its logo. It's got the city commission, but then it has its logo, so
I think we
yes,
should do that.
DAG can also develop
Let's do
your
it.
own logo.
Yes, let's do it. Okay. All right, but did we get a picture?
Yeah, with
No,
her.
I'm good. Don't worry.
The next time.
Next meeting, I'll come in
She's
all.
gonna come all dolled up.
Okay, on the second page of the Facebook, we're gonna have her picture saying she started this Facebook.
No, Arnold did. I wanna give credit where it's due.
Well, Arnold, but you're giving it more,
Helping him out.
Yes.
We're working together.
great, thank you so much.
He said it, both of them.
Yeah, it's with, I said I wanna help him out. It's, the work is even. We met up, we discussed it and what possibly could go on there, and we agreed to it, so we're just kind of putting stuff on there.
Okay, wonderful, thank you.
Okay. Brown bag. I need a motion
Motion
to,
to adjourn.
thank you. We have a first,
I have it.
second. Call for the question, all in favor? Motion passes.
Thank you.